So what I'm hearing out there is that more often than not, you start to see an increase in reporting when we're educating our clinical teams and we're educating our leaders on violence, workplace violence. What are the signs and symptoms of these types of behaviors? Typically, nurses have just taken it as part of their job, but now they understand through education of both themselves and the leaders that these types of behaviors are not acceptable in the workplace. You know, when nurses are working in an environment that they are being bullied, chances are they're not going to stay in that environment. Nurses have lots of options in different settings today, so working in an environment where you don't feel safe or you have colleagues that you can't communicate with, one, is going to cause a turnover in the nursing workforce and not just nurses. And two, it'll cause quality of care issues, because if you have a nurse that is being bullied in a clinical environment and a situation arises where they need advice, clinical advice from a more experienced nurse, they're less likely to reach out because they feel already bad about themselves or have been bullied or intimidated to feel that they are less of a nurse. So some of the side effects as a result of lateral violence, bullying in the workplace, definitely could be quality of care issues, as I had mentioned before. Certainly if there's a clinical issue that a nurse feels that they need some advice on, or a medication issue, or just a changing clinical situation with a patient, they are less likely going to reach out to, let's say, a charge nurse that's been bullying them, or a colleague that has more experience than them, if that colleague has made them feel inadequate with their nursing care and knowledge. In addition, a nurse that goes into a patient's room, if you have a patient that has escalating violent behaviors, that nurse, again, if that nurse has been bullied or does not feel adequate in their skill set because of that type of bullying or lateral violence, are less likely to reach out to a colleague for assistance, which ultimately could create an unsafe environment for that nurse. I would like to think those guiding principles actually have led to the increase in reporting that we're seeing. Because nurse leaders are now educated, we have those guiding principles on how to engage their staff, such as having their staff be part of any type of improvements in the environment, to help create a safer environment, you know, that kind of a thing. I think those types of issues that have been discussed in the toolkit are things that are being passed on to the nursing staff from their leaders who have gotten that through the AONE toolkit that was developed with the Emergency Nurses Association. So we know that the initial work that was done with the American Organization of Nurse Executives and the Emergency Nurses Association is now a few years old, and we wanted that work to get done and out there right away. But we also know that security is a key partner in creating safety in the workplace. So we have actually another meeting set up with the International Association of Healthcare Safety and Security Professionals and AENA and AONE as well, to go to the next step, to really what can we do now that we're working with our security professionals from an education standpoint. What are some of the best practices for de-escalating violent behaviors in the workplace? So that's what we're working on currently. I would say certainly to, one, know your resources. We do have resources that are on our website, and that also has resources attached to it. There's a lot of work that's being done from an American Hospital Association perspective to workplace violence, so the resources are all pulled under that website as well. And certainly to reach out to colleagues that have some best practices. You know, our behavioral health colleagues have been dealing with different types of violent issues in the workplace and have come up with some excellent best practices in education that they can teach their staff on early signs and symptoms of these types of behaviors that could ultimately lead to an unsafe situation. So we're going to be having an upcoming webinar where we're going to have nursing leadership working with our safety and security leaders and give examples of de-escalation techniques that they're currently using to create a safer work environment. So please look out for that.